The Ebola outbreak in Central Africa is growing with nearly 600 suspected cases and at least 139 suspected deaths in the Congo. The World Health Organization saying the numbers will keep going up given the virus was likely circulating before the outbreak was even detected. As ABC's Reena reports, an American doctor who contracted the virus is now receiving medical treatment in Germany.
As the numbers rapidly rise, health officials racing to contain the Ebola outbreak in Central Africa.
Given the scale, we are thinking that it has started probably a couple of months ago.
Among the hundreds believed to be infected, Peter Stafford, a doctor from the U.S. The medical missionary transferred from the Congo to a hospital for medical care in Germany. New video shows him arriving in Berlin.
Everybody in the ambulance was wearing what they call full PPE. There's not one centimeter of exposed skin.
Colleagues revealing how he may have contracted the deadly virus.
He did the surgery on this sick patient a week before the epidemic was finally identified as Bundibugyo Ebola virus.
Travel plans also made for Stafford's wife, their 4 young children, and another missionary doctor who may have also been exposed to an infected patient. This week, the World Health Organization convening for an emergency meeting, saying the risks are high regionally but low globally.
The situation is a public health emergency of international concern, but is not a pandemic emergency.
The Ebola virus can mimic flu-like symptoms and progress to internal bleeding and possible death.
Right now, there is no FDA-approved vaccine to treat this strain of the Ebola virus. However, the head of the Africa CDC says scientists are exploring 3 experimental options. Reena Roy, ABC News, New York.